So, a massive new law just dropped. It's over 1,000 pages and it's been nicknamed the One Big Beautiful Bills Act, or OBBBA for short. Today we're going to cut through all that noise and focus on one of the most critical parts, the sweeping changes it makes to Medicaid, which, as you know, provides health coverage to millions and millions of Americans. So, here's what we're going to cover in this explainer. We'll start with how this bill is really reshaping a huge piece of American healthcare. Then we'll dive into the new rules for the people who actually use Medicaid, the new pressures this puts on states, the political dogfight that led to this thing passing, and finally, what this all means for the future of Medicaid. All right, let's dive right in with the big picture. And I want to be clear, this isn't just some minor tweak. We're talking about a fundamental reimagining of a program that's been a cornerstone of the healthcare safety net for more than half a century. And that really gets to the heart of it, right? When you have a bill this huge, it's so easy to get lost in the weeds. So what we're going to do is focus on a simple question. What are these changes actually going to mean for the millions of people who rely on Medicaid for their health? Okay, so let's get into how this law actually affects people, day to day. These aren't just abstract policy ideas. We're talking about brand new requirements and, in some cases, new costs for people who are on the program. First up, and this is a big one, is something called the Community Engagement Requirement. Now, this isn't a small change. The idea is to connect health coverage with activities like work or volunteering. But what it really does is fundamentally alter who's eligible, potentially creating a brand new barrier to getting and keeping healthcare for a lot of adults. So, how does this actually work in practice? Well, people will have to log at least 80 hours a month doing things like working, job training, or even community service. And then, and this is the tricky part, they have to report all those hours to the state, which then has to have a system to verify them. If you don't do it, or can't prove it, you could lose your health coverage. Now, it's really crucial to know that this rule doesn't hit everybody. The law does carve out some really important exemptions. We're talking about kids, seniors, pregnant individuals, and also people who are the main caregiver for a young child or for someone who is incapacitated. But that's not all. On top of the engagement rule, the bill also gives states a green light to introduce new out-of-pocket costs, things like monthly premiums or co-payments, even for people who've never had to pay anything for their Medicaid coverage before. Now, there is a guardrail here, which is important. The law says that the total amount a family has to pay in premiums and other costs can't be more than 5% of their total income.
Okay, here's another really significant change, and it has to do with something called retroactive coverage. It used to be that if you signed up for Medicaid, it could cover your medical bills for up to 3 months before you even applied. Now that window has been slashed down to just 1 month. You can see how that could leave someone with a mountain of debt from a car accident or a sudden illness that happened right before they could get enrolled.
So we've talked about individuals, but what about the states? Well, these changes put a whole new set of pressures on them too. We're talking about major new financial and administrative burdens shifting right onto their shoulders. To really get what's happening at the state level, you first have to understand this tool they use called a provider tax. It sounds complicated, but the idea is pretty simple. States tax hospitals, for instance, and then they use that revenue to get more matching funds from the federal government. It's a really critical way they pay for their share of the program. See, under the old rules, things were pretty straightforward. There was this 6% threshold for these taxes. But this new bill throws that out the window and brings in a way more complicated formula. The result? A whole lot of new uncertainty for state budgets. The Act also puts limits on another key funding tool, something called state-directed payments. These are basically extra payments that states make to managed care plans to make sure hospitals, especially safety net hospitals, can afford to treat Medicaid patients. And here's the new rule, a cap. Many of these extra payments are now capped at 110% of what Medicare, the program for seniors, would pay for the same service. What that really means is states now have less flexibility to support their local hospitals or address unique health needs in their communities. Okay, so how on earth did all these huge changes actually get passed into law? It was definitely not a straight line. Let's pull back the curtain and take a look at the intense legislative battlefield that shaped these Medicaid rules. You can see from this timeline, this was a real nail-biter. The Medicaid provisions were front and center in all the negotiations, right up to the very end. From speeding up work requirements just to get the bill out of committee, to promising deeper cuts to get key senators on board, these changes were at the absolute heart of the political fight, which ended with a razor-thin vote in the House.
And this led to a lot of criticism. As NPR pointed out, for many people watching, the final bill, especially with these major changes and potential cuts, seemed to fly in the face of earlier promises not to touch Medicaid benefits at all.
You know, what's almost as fascinating as what's in the bill is what got taken out. To get through the Senate, the bill had to follow something called the Byrd Rule, which basically says everything in it has to be about the budget. Because of that, they had to strip out several really controversial policy items, like a proposed ban on Medicaid funding for gender-affirming care. All right, so let's zoom out and look at the big picture. Now that these rules are in place, what are the long-term consequences going to be for this absolutely massive health program?
So let's just boil this all down. For the people on Medicaid, it means new hurdles to clear and potential new costs. For the states, it means new financial headaches and a lot less flexibility. And for the country as a whole, this law represents a huge philosophical and financial shift in how that 50-year-old partnership between the federal government and the states actually works.
And really, that's the big question we're left with, isn't it? When you introduce all these new rules for patients and new financial burdens for states in a program as enormous as Medicaid, how will that ultimately reshape the future of American healthcare for absolutely everyone?